Good afternoon. We're here with Humboldt County Health Officer Dr. Teresa Frankovich for the July 15th media availability.
Hi.
Hi, thank you so much for being here with us. Can you tell us a little bit about the state's order that just came out on Monday, reeling back some businesses?
Sure. So again, and I recognize this is a surprise for us locally and a disappointment certainly on the part of many. Locally we're actually doing fairly well right now. Our numbers look pretty good. We are not on the county monitoring list, which is a good thing because it would have been a more extensive step by the state had we been. But I think essentially from the state perspective, they are looking at the sheer numbers of cases that are being seen in California right now, the rapid increase in those cases, the increase in hospitalizations and ICU. And one of the other drivers of this is the positivity rate in testing in general for the state, which 8% is considered sort of a threshold or worrisome level, and we've been approaching that number quickly. So I think, quite honestly, I think that this is a measurement, an intermediate measure that's meant to help prevent us from getting to a place where we have to do a completely restricted back to full shelter in place mode. And so, and I think essentially our counties are being asked to participate in that effort. So the list basically for us is that the state is sort of pointing out the fact that there are some activities that we are doing that are inherently riskier, and they are inherently riskiest indoors. And so the idea is to be able to take some of those things that are, riskier by nature, more social interaction, and either eliminate them for the time being or to move them to an outdoor space where there is less risk. So for instance, bars in the governor's statewide order are closed. Basically for bars to be serving customers, it would need to be outdoors and only if there is food service involved. So again, the restaurants/bars are used to this situation and again can do outdoor service. For bars who are not food service entities, they are not operating. For some of these entities that contract with food service to have it on site, basically the rule of this order is that food and alcohol must be done as a single transaction. So it is not the intent of this that people are going and drinking and then somewhere in there, ordering some food. It really is meant to be essentially a meal with a beverage that is authorized. The other pieces of this that are moved to the outdoor segment are, again, restaurants, as well as wineries and tasting rooms, movie theaters, so drive-in theaters only would be allowed under this, family entertainment centers. Those included things like bowling, which of course is not going to be an outdoor sport. Putt-putt golf would be allowed in this instance. And again, movie theaters had sort of loosely fallen in that category and they would not work unless they're outdoors. Zoos and museums, their outdoor attractions are able to be open, but not indoor, and then card rooms. So those are the things that are the changes that are made as of Monday. With the governor's announcement, we looked at the written versions of these in the health officer orders and talked about this yesterday. The order from the state's perspective is effective immediately and supersedes our local opening.
Thank you so much. Now here's some questions from media. What kind of preparedness can people who suffer from debilitating illness do to prevent a more serious onset of the virus, such as respiratory, heart, or asthma problems?
So certainly when we look at this virus, it's challenging because unlike things like flu, where you may do very well or you may struggle, but when you're done with flu, you're typically done. This we are seeing certainly can have some persistent ongoing health impacts. It has not been around long enough for us to know how long those impacts may be. That being said, we also know that some people with underlying respiratory or heart problems are more vulnerable to the virus in the first place in terms of serious impact. So what I'd like to emphasize is that, for people who do have underlying chronic conditions, obviously we want them to sort of stay out of circulation as much as possible, really shelter in place as much as possible and reduce your risk of exposure. If you're out and about, using all those protective measures is especially important. And I also think that it's really important for people to be taking care of those conditions. So it's important to get your routine medical care, make sure that your asthma is well controlled, or your COPD, that your high blood pressure and those types of things are managed well, so that you're in the best possible shape should you become ill. In terms of preventing the long-term sequelae of this virus, basically anything we do to reduce our risk going in, being as healthy and as good shape as possible, benefits all of us. So,
what suggestions do you have for people to boost their immune system to be healthier and be prepared in the likelihood of infection?
So again, I think, for all of us, all the things that, public health really talks about all the time, right? So it's, the idea of having a healthy diet with lots of fruits and vegetables and whole grains. It is the idea of getting exercise so that, we are in good cardiovascular health, and also getting plenty of rest, which is difficult, I know, sometimes for people, but really important. And I also believe stress reduction, using any tools you have personally that help you reduce your stress. So whether that's hiking out in the redwoods or going to the beach or being with your family and, playing cards at night for your household, whatever that is that helps you reduce stress.
The New York Times released an article yesterday that read, "Trump administration strips CDC of control of coronavirus data." What does this mean, and is it a dangerous move?
Well, I actually have grave concerns about this. The Centers for Disease Control is a public entity. It has been depended upon by the medical community, healthcare community, and many other people to be sort of a very public viewing and vetting of information that's available. I think all of the data that comes out of this pandemic is going to be very important, not only for managing this pandemic, but for learning down the road. And I think having a public platform for all of this information that is not privately controlled is essential.
Some people appear to believe that the rate of transmission of a virus is fixed, but differing strategies affect the rate of transmission. Can you please explain how PPE availability, especially for frontline healthcare workers, affects the rate of transmission of a virus of this nature, which doctors and epidemiologists now know is being transmitted by aerosolized particles from basic human functions like exhaling, coughing, sneezes, and singing, and how the rate of transmission is able to fluctuate in a community?
Oh boy, well, there's several questions there, but we certainly are learning a lot more about this virus and transmission. We do know that certainly large droplets play a role, and I would point out that some of these activities, such as sneezing and singing, involve sort of a range of size of particles, right? And so some of the things that we are learning about this virus is that some activities are riskier for spread. So things like coughing, sneezing, singing. But even loud talking. So, it's, and it also appears that some individuals are just more effective at transmitting that virus. And it may actually be, from some early research, that there are some strains of the virus that lend themselves to being transmitted more easily. So, again, there's a whole lot to learn here. In terms of PPE, when we're talking about healthcare providers, we're talking about masks, facial masks that actually are barriers to protect the wearer from those small and larger particles. When we're talking about what we're doing as a community, the facial coverings we're using are really meant to sort of trap some of those large particles, especially that we breathe out or sneeze out or cough, and to protect the rest of the people in our environment from coming in contact with that. If we're all wearing them, we will reduce the amount of virus that's basically out there and available for people to be exposed to.
You've talked about cases within the cannabis community and also how people that do not permanently reside here are not included in our total case count. With both of these things in mind, how many positive cases have actually been reported in southern Humboldt? The county dashboard has shown 4 cases for at least the last 2 weeks. which seems on the lower end compared to other areas.
Well, again, the case counts as we present them on the map are accurate, but people just need to bear in mind that they are not where you contract the virus, they are where you reside. So that the address for the person who tests positive is what is there. And so, we just want to emphasize to people that, again, knowing in particular where whether that information is on a map that gives you a town or it gives you a region of the county or however that information is conveyed, it really only tells you the residence of that person. It could be a person who resides in Eureka, but actually was exposed during a trip to Idaho, for example. And so it really doesn't give you that level of risk for your community.
Let's shift gears a little. Where do you stand on schools reopening this fall?
Well, I'm a pediatrician and a public health person, and I would love to see kids in school. I think that when we've been having ongoing for many weeks conversations with the schools about what this might look like for the fall. We have been, just as the Academy of Pediatrics and the California Department of Public Health have been advocates for really working to have things structured so that kids can be in the school setting, where I think we can all agree it's an optimal setting for almost all children. That being said, the conditions on the ground with this pandemic change rapidly, as everyone knows. So the schools are basically looking at all the safety guidelines. They're constructing plans for how they might operate with full instruction, how they might operate if we use a hybrid model of distance and on-site learning, and how it might look if they do distance only. Recognizing that it's not a one-size-fits-all for all of our schools, and also that the situation on the ground will require them to be fluid. And so, while I am hopeful that we may be able to have schools operating with full site instruction, it's not clear yet that that's the case, or that if we do open that way, we will be able to continue in that vein through the fall.
You've said contact tracing is impacted by delays in testing and increased social contacts. If contact tracing is strained now, how will it not become a more dire situation if schools reopen for in-person instruction?
Well, right now, our contact tracing capability is really good. The thing that we can control internally is in good shape. We're challenged right now by the testing, as everyone knows. Probably a month ago, we felt we were in pretty darn good shape in terms of being able to do both surveillance testing and capacity to test everyone who was sick as well as their contacts. We're finding that increasingly challenging with supply chain issues and such, and delays impacting our large commercial labs. So it's a fair point. The testing capacity is an important piece of our response. I think, at this moment, we could probably manage this. I think that it, depending on what we're able to construct over the next month or two to help us move forward, it will have an impact on how we're operating.
What PPE is being provided to local school districts, and what interactions have there been in providing that to 31 districts across the county and the County Board of Education?
So I think, it'd be great also to, talk with the schools and get some information about where they're sitting. Certainly we've received at the county level some facial coverings for kids. And sort of allotments per child. So I think that's great. And the schools are also sort of evaluating what they want in place for their staff in terms of their facial coverings. In general, I would think that teachers are going to be using, facial coverings like their students. There may be some use of face shields for some entities, face shields with drapes as a mechanism. But the important thing is that everyone's using facial coverings.
And I think you've answered this, but it's summertime, which also means the new school year is just around the corner. What sort of guidance is public health giving local school districts and administrations when it comes to reopening schools in the fall? And do you think it's feasible for children to return at that time? And if so, what are your major concerns? Or is distance learning a more likely possibility?
Well, again, I think you're right. We really answered that. I think, distance learning is certainly not the optimal solution for this, and we'd certainly prefer a hybrid or full on-site model if at all possible, and are working towards that.
Governor Newsom's announcement to close a handful of business sectors this week appears to be somewhat of a step back into the stay-at-home order. Do you anticipate a seesaw pattern of reopening some business sectors and closing them again as we progress through the summer and into the fall?
Well, we've certainly talked about this along the way, is that, this idea that we would need to perhaps pause or step back. And, it's certainly not anyone's desire to do so, but it is certainly, as we're seeing right now, a very real likelihood. And my hope is that if we're able to manage our cases well in terms of slowing transmission rate locally, that we may be pausing or moving back on a statewide level, but may not need to make those steps independently here locally based on our conditions. I want us to be doing as well as possible regardless. And again, it is, dependent on many factors, not the least of which is just how we all approach this and, how well we adhere to these guidelines. And, trying as a community, I think, to really keep things moving forward.
What gives the county the authority to delay implementation of the state order which went into effect on Monday?
So, the state order is in effect. There's no question about that. I think there was a recognition that it was extremely short notice for businesses. Certainly I understand that a restaurant who cannot open to outdoor service is suddenly sitting with a refrigerator full of food, and that's a problem. Even if you were simply going to close up, there needs to be work done to do that. And so I think simply what the sheriff was pointing out was a recognition that for people to sort of ratchet down and close or reset up, that it might take a period of a day or two to do that. My understanding is that, the local enforcement piece of this will begin on Friday, and just allowing these businesses to make that pivot. I think since the order went into effect and that it is there for our community, I think that the piece of this is that in our situation, it was not an emergent close based on our local numbers, and I think that gave us a little ability to be sensitive to the needs of the local business owners.
Some business owners forced to close indoor operations feel they were blindsided by the order to close and see it as unexpected. Does the county have any way of warning these businesses about the closures ahead of time so that it comes as less of a surprise?
Well, we would certainly like to be able to do that. And honestly, we had very little notice that this was going to happen. So it was really a fair surprise to us as well, and no real ability on our part to be able to do anything in messaging to the community to let them know. And again, I think we all need to recognize that this is a really fluid situation, and as the state is looking at the numbers and the data every day, as are we. And the numbers tell you something different every day. And I'm sure at the state level, there was a great hesitancy to make this move, and really felt that there was really no other option to try and turn the tide here.
Regarding decisions to close businesses, roll back reopenings, and implement local policy changes on this level, can you please clarify who makes the final call on this between yourself and Sheriff Hansel? Which of you is higher ranking in terms of policy decision making in the context of this pandemic? Or is this decided in another way?
So, it really is not a single person driving this operation. It wouldn't be possible to do that. So, everyone brings their sort of skill set and expertise to the table. We have a policy committee that meets and really looks at all of these types of issues and sort of makes some decisions about how we move forward. That being said, as the health officer, I have the authority to issue the order. That order is law locally. I count on the cooperation of the sheriff and the other law enforcement entities in the county to help us make sure that order is implemented. And that's the case really whether it's a state or local order. Again, our approach on this has been to try and frame this as an educational piece with the hopes that most people, when they understand why things are necessary and the rationale behind them, are willing to step forward and work to protect their workers and the community. It also is important to have that enforcement piece if people are not doing that and behaving responsibly. I appreciate that most people are and have really been making an earnest effort. And honestly, I think our numbers reflect that. It's not only the hard work of contact tracers and people doing the testing in our lab and all of that. It is the actions of the majority of our community who is helping to keep us in relatively good position, and I appreciate it. But for some entities, the enforcement piece is necessary, unfortunately. And I do count on that collaboration, and the sheriff has been a partner throughout this, as is necessary. He is the ICS commander.
Excellent, thank you so much.
Thank you.